Good day everyone! Today's video will be about the infectious diseases fighting the invisible battle. In this video, we will be discussing about what are infectious diseases, how do diseases spread, and how do we deal with infectious diseases. According to the World Health Organization, infectious diseases are caused by pathogenic microorganisms such as bacteria, viruses, parasites, or fungi. The diseases can be spread directly or indirectly from one person to another. However, there are other microorganisms that also live inside our body that does not bring harm. Instead, they aid in our metabolism and even protect us from pathogens that try to colonize our bodies. Unfortunately, there are microorganisms that make us sick. That's why it is important for us to study infectious diseases to protect ourselves from its consequences such as sepsis and even death. How does this microorganism spread? We will introduce to you to the chain of infection by American Health Association. Chain of infection is the way on how pathogens spread or transmit from one to another. Therefore, we must understand the chain of infection to prevent and control infection. The chain of infection is made up of 6 different links. Infection happens when each link is present in this order. However, each link is easy to break, which prevents disease and keeps the patient safe. Now let us discuss each link. Infectious agent. It is the microorganisms that cause disease, or in other words, the pathogen. To break this link, seeking proper medical treatment if you are ill, and using appropriate cleaning solution to disinfect the pathogen you have identified. The second link is the reservoir. It is where the pathogen can thrive and reproduce, such as doorknobs, damp places, and even people. To break this link, wash your hands, keep your home clean, and disinfect surfaces properly. Next is the portal of exit, which is how the pathogen exits the reservoir, such as sneezing or coughing. To break this link, wear proper protective equipment, wash your hands, proper disposal of garbage, and cover your mouth or nose when coughing or sneezing. The next link is the mode of transmission. This is how pathogens are carried from one place to another. To break this link, wash your hands, control airflow in negative pressure room, disinfect surfaces properly, maintain proper food hygiene, and observe isolation precautions. The fifth link is the portal of entry. It is how pathogens enter a host, such as entering through wounds. To break this link, healthcare professionals use antiseptic techniques during procedures, proper caring of wounds, washing hands, and properly caring for catheters. The last link in the chain of infection is the susceptible host. It can be elderly patients or patients that are immunocompromised. Health workers can break this link by treating the primary disease and identifying those who are high risk for infection. How do we deal with these pathogens? There are 5 steps that we can do to take action against pathogens. First is we need to establish the presence of an infection. As a health professional, we need to verify first if the patient has really an infection, since there are several disease states and even drugs that can mimic infection or its signs and symptoms like drug fever. Second is to identify the site of an infection. There are places in our body that some pathogens are known to thrive. Therefore, we can use these sites to manage the infection. Third is to identify the primary pathogen. Once we identify the site of infection, we can get the sample of the suspected pathogen and send it to the laboratory for tests to confirm the identity of the pathogen causing the disease. Fourth is selecting the appropriate anti-infective agent. For the infection to be controlled, several antimicrobials can be considered, like checking their spectrum of activity, clinical efficacy, adverse effect profile, pharmacokinetic disposition, cost, and patient factors. Last is monitoring and modifying. Once the appropriate anti-infectives has been selected, the agent will be monitored as well can be modified or changed as the course of therapy goes on, based on patient factors, site of infection, route of elimination, and other factors. And that's it! Those are the ways in fighting our invisible enemies. Thank you so much for watching and be healthy always. Happy National Pharmacy Week! This video gives credits to Association for Healthcare Environment of American Hospital Association. This was presented to you by your future pharmacists, Janica Maris Colimar and Sunshine Mel Sagnoy, a special project from Manila Adventist College Department of Pharmacy.